Hello, this is Dr. Gay from First Look MRI, and this is a 73-year-old male with complaints of heel pain. They have a marker over their heel, and it's just a quick case of common finding. This is the back of the calcaneus back here, the posterior calcaneus. This dark band is the Achilles tendon that comes down here. The muscles end, and we have a dark tendon that comes down. It's relatively low in signal, a little bit of increased signal here along the outer edge. And this is what we call tendinosis. When it's not jet black and it looks more gray like this, we call that tendinosis. On this view, we have a fluid sensitive sequence where fluid will show up as bright. So we see the dark Achilles tendon as we go off to the side where the marker is. We see some foggy brightness here in the bone. Normally bone will be very low in signal in this sequence, and we see this bright area here. We call this marrow edema. So the Achilles tendon is inflamed, which we can see over here, that gray signal. We have reactive marrow edema from inflammation irritating the bone back here. We also have a spur. You can see a little bony spur right here, a retrocalcaneal spur in this x-ray. Also we have, again, this bursitis, acute retrocalcaneal bursitis, a little fluid pocket here and a potential space right where the Achilles tendon attaches. And lastly, we have one more thing back here. There's a fat pad. We'll see it better on this view. Below the muscle, in front of the Achilles tendon, we have a fat pad. It should be bright and uniform, and instead over here it is more heterogeneous rather than low in signal here. It's a little bit bright, so there's a little bit of edema in this little fat pad. We call this peritendinitis, inflammation along the anterior margin, the peritenon of the Achilles tendon. So very mild peritendinitis with retrocalcaneal bursitis and Achilles tendinopathy with retrocalcaneal spurring, just bread and butter findings in this patient with heel pain. And that's it. Thank you so much.